Зараз я до слова запрошую заступника міністра охорони здоров'я Ігора Перегінця. Говорити будемо про стан виконання програм.
Igor Perehinets, Deputy Minister of Healthcare of Ukraine, will be talking about the situation in Ukraine with anti-HIV/AIDS medicines provision. Good morning, dear colleagues. For a few weeks, there was a concern expressed on two issues on implementation of the plan of treating Ukrainians abroad. Yesterday there was the sitting of the Ministry of Health of Ukraine as to decision to send for treatment abroad. 73 cases were considered. The decision was made to pay for treatment of 17, 8 of them are children, for the total amount of 45 hryvnias. I would like to mention that the citizens of Ukraine are sent abroad mostly on oncological, neurological, cardiological diseases. In case the Ukrainian medical institutions cannot provide assistance, all the documents which are sent abroad are first considered at the Commission, and the decision is made for each particular case. In the budget of 2015, it is planned to allocate 243 plus million hryvnias for treatment of Ukrainian citizens abroad. Yesterday, the Commission identified 17 patients, out of them 8 children, to be sent abroad. The Commission also made the decision on other 37 cases. The total need is 137 million hryvnias, which will be raised this year and next year for treatment of these people. The sum which was increased this year was increased due to the NGOs which are working on this issue. Last year only 52 million were allocated for that. This year the sum is much bigger. Yesterday, significant amount of that money was used, and we are now sending the patients for treatment. I would like to thank the NGOs. There's the fund Tabletочки present here, which partially provided some funding for patients, for children, which is most important. And yesterday we agreed that to improve the cooperation so the children who cannot be treated in Ukraine can get treatment abroad. We signed the joint memorandum on cooperation, and also we agreed that the procedure of registration and making the so-called line so that it all is happening transparently and efficiently. We agreed with Madam Karczynska on forming the intersectoral working group, which will be identifying the principles of treating abroad those who suffered in ATO zone. Now there's money planned in the budget, but we need to finalize some formalities to be able to use this money. We are initiating this work with the Ministry of Defense and other law enforcement bodies, and will define the algorithm of interaction. That is on the first issue. On the second issue, you know that the topic of possible stopping of treatment of HIV patients could happen because last year the medicines were purchased, but now there's a deficit of these medicines. On the 23rd of December 2014, the Ministry of Health of Ukraine paid in advance 100%. And we would like to mention that according to the law of Ukraine, there are limits set as to purchasing the medicines for which money was paid in advance, but the supplier informed that it cannot execute the agreement and apply to the Court of Appeal about increasing the sum of the contract. And they want to increase the total amount by 10 million. But now the limits are set as to setting these limits. Also, in accordance to the agreement, the money could be paid only. And the Ministry of Health and the supplier, they have the agreement, but taking into account that there is this appeal sent, we cannot exclude the situation of crisis. The Ministry of Health of Ukraine has done a lot to plan to redistribute the medicines in the regions to understand the situation better, which will give us an opportunity to provide treatment for patients. Natalia Nikolaevna will inform you in detail. The experts, the regional centers of HIV/AIDS managed to find out that we will be able to provide treatment till the end of June to the patients which are using antiretrovirus therapy. This allows us to continue negotiations with the supplier, Vector Pharma, so that they execute their commitments. The Ministry of Health paid in advance back in December, and we know we coordinate the work with the patient organizations who actively cooperate with this, talk to the supplier, and the producer informs us that they are ready to send the whole batch of the medicines as soon as they get prepayment, and they agree to some financial compromise. Now the importer has to execute its commitments and not to cease the treatment. We replan the scheme of treatment, guaranteeing this way that the treatment will be continuous, and by the end of June we have resources not to stop treatment, which is quite serious risk. Natalia Nikolaevna, please.
Давайте я
Good morning, dear friends. Let me add to the information Evgen provided about steps of our steps together with our Ministry of Healthcare. Starting in April, we calculated realistic availability of preparations in the region. We decided on May 25 that in 13 regions of Ukraine we have no risk of stopping therapy for patients. At the same time, in 20 regions of Ukraine, where we have quite a big number of patients who get antiretroviral therapy, the threat could be. That's why since April we started adequately and gradually to move patients who receive preparations for the first line that are provided by Vector Pharma to similar schemes. In April, May, they were provided two analogous. We switched 1,015 patients. We work with regions until the end of June. We'll provide non-stop therapy and quality in 6 more regions of Ukraine. So we'll move them to a similar schemes and about 4,000 patients. That's why since April to June, 4,000 patients are switched to analogous compatible schemes of treatment, and that is a non-stop therapy, and that allows us to correct the situation as to the presence of preparations, and we can redistribute the preparations between different institutions. Today we have a source in the penitentiary source because they have a reduced number of inmates in the system, and we are planning to redistribute those preparations. First of all, on the controlled by Ukraine territory in Luhansk and Donetsk regions in order to provide a non-stop antiretroviral therapy. The ministry appealed to the center with a proposal to set up a technical working group to develop recommendations for doctors and information for patients as to planned and adequate switch of patients to other schemes of treatment. In addition to that, we have a consulting group, and they provide advice through teleconferences to all the regions on concrete patients and concrete cases our doctors are facing. Also, I'd like to inform you that several days ago, Global Fund supported the appeal of Ukraine as to use an additional money in the cost of saving money from previous grants, and it's $7.3 million. 4.6 of which will be funded by additional antiviral therapy, and the medicine will be in Ukraine in August and September. That will allow us to finish the year, and also we will accomplish the state program as to cover a broader number of patients and that therapy, and also we'll continue treating those patients that are treated in the cost of Global Fund. So that's why the situation we have really needed changes. Changing the schemes of treatment for 8% of all the patients, and we have about 63,000 of them, for us to prevent stopping the treatment because of the planned work and clear monitoring through electronic instruments on national and regional levels. We have a clear picture about the regions and clear understanding that there will be no break in the therapy of a patient until the end of June. Thank you. Colleague, journalist, your questions, please. Radio Liberty, Bogdan Kostyuk. I have, as a volunteer, Ministry of Healthcare and certain structures control, do they monitor, do they have enough preparations to control donors' blood? Because now, there were several cases of hepatitis among 80 soldiers who received that blood. The situation is not the ones we would like to have. We cannot cover all the needs in 80 area, but the ministry puts maximum of efforts to find internal resources and also to coordinate the work between all the centers of blood in the regions. There is a disagreement between the ministry and agencies in that issue. That's why we have some working groups to coordinate that work, and very soon, because the situation is improving, we can, as I told you, we'll have that group, and it will provide more information and data for us to think about coordination, because there is no other problem but no coordination. Resources and products of blood, they are accessible. They need to be calculated correctly. We need to know where they are, to use, to deliver, and so that's the issue. That's a logistic issue, nothing else. What's the situation Ectopharm supplier? They went to the court. Will they provide preparations or not? According to the contract signed in December last year, the supplier is still within the contract and can provide those preparations by the 20th of June. But because the supplier referring changes in the currency rate and they appealed against the Ministry of Healthcare through the administration court and they demand to pay more, but Ministry of Healthcare doesn't have reasons for that, and so there's a risk that there will be no timely supplies of preparation. That's why we are planning these things, like planning. We need to save our patients from stopping their treatment. So we care about our patients. That's why we want to prevent negative effects. Suits and no supplies, that puts us into the situation where we have to be ahead of potential risks, and that's what we are doing. If there is a question to our speakers, please. Thank you very much. Thank you very much. If we have representatives of civic organizations, please be brief, because we have the next briefing. Oksana Gorchinska, first deputy head of the committee in the parliament on healthcare. And I feel myself like a civic activist, like in the old times, because I came to the with the fund Tabletочки. Just yesterday, we've found out about this briefing. We are not behind of the Ministry of Healthcare, because the methods they are using, they remind me famous times of Yanukovych, except Mr. Deputy Minister Perehinets, to whom, as a member of the committee and my activists, I hope, volunteers, we still have, he's the only one whom we trust as a representative from the Ministry of Healthcare. Yesterday, we were at the meeting.
Well, we yesterday at the sitting of commission, which was deciding on sending patients abroad. This commission has been in place for many years, it's functioning, and I was the representative of Ahmadit, and I was present at this commission in February, but I learned about that in May. All the activists were excluded from the commission. There's not a single representative of the public in the commission. There are only invited. After that, myself, as the member of parliament, the member of the committee of Verkhovna Rada on health protection, and I'm still the chair of the council of Ahmadit. I started the scandal at the meeting of the Verkhovna Rada that commission hasn't had the sitting not a single time since 26th of February 2015. Yesterday was the first time after that. Now, Mr. Perehinets is personally responsible for that commission, but that's from yesterday. For 3 months, the commission had not a single meeting, not a single patient, including the children with oncology, were sent to treat abroad. This is our Colonel, Lieutenant Colonel Golitsyn, who was wounded on the 26th of August. I was transporting him from Mariupol. I know the whole story of how he was wounded. Now he's blind. He was demining the territory so that our troops could move. His only hope to have at least to be able to see his treatment abroad. From the 30th of April, Azov Battalion, volunteers and the family are trying to submit these documents to the Ministry of Health, to this line. He's official, he's the Lieutenant Colonel, he's the participant of warfare in Afghanistan. He's not young. And this is the person who became disabled because he was protecting Ukraine in Azov battalion. Since August last year, they failed to submit his documents. There's not a single serviceman registered in the Ministry of Defense. Yesterday, for the first time, thanks to the members of parliament, thanks to the activists, the issue was raised on setting up the commission, joint commission with the Ministry of Defense that will develop which documents are to be submitted to Ministry of Health to register them. Even this budget, 152 million, which was allocated in February, in March it was officially confirmed, and the list of documents, what documents should the serviceman submit to get treatment abroad. Only yesterday, after we were pressing, they will start thinking about which working group to set up to receive the documents from servicemen. The first deputy minister of Public Health, Pavlenko, was personally responsible for that all the time. These are the invoices. Please give the floor to the activists. Allow me to feel that I'm not just a member of parliament, but I'm an activist as well. I understand that we did not pay. We did not pay for that time. I believe that there are not many people who are loyal to activists, but these are the invoices of children with oncology. 3 of them died. Yesterday, the documents were submitted in February. This child died last Saturday. For two of them, Tabletочки Fund was raising money. When they came to Italy, the doctors failed to help them because they were raising money for many weeks, from up to 140,000. Yesterday there were 48 persons, 38 were submitted additionally, and 40 are not registered in the line. There are 10 children. Olga Kudinenko is the founder of Tabletочки Fund. She knows the situation with oncology patient children better than anyone else. 10 of them are not even registered in this line. But that is the law of Ukraine, irrespective of whether you are sent for rehabilitation or you have some lethal disease, you are waiting in the same line. The civil servants are not interested in the health of people. They're not interested whether this child will die tomorrow, the young man will die the day after tomorrow. They're civil servants. They're interested in what will they tell to the General Prosecutor's Office, why they send this dying oncology patient. We have the child whose documents were not even registered in the Ministry of Health. We failed to find 10 packages of documents of children, 10 children, and talking about medicines. As the first deputy head of the committee of the Verkhovna Rada, for the first time I received the reply from the Ministry of Health. I sent more than 30 requests, and that is the first reply, and that's on the medicines. Same way, yes, 2 days ago I met with the heads of departments of the public health of Donetsk region. They have not seen a single person, a single representative of the Ministry of Health in the ATO zone. Igor has never been there, minister has never been there when we had 118 wounded people in Mariupol. Not a single head of the Ministry of Health visited the ATO zone. I have 28 requests from the Department of Health of Donetsk region to the Ministry of Health, and there's not a single reply. That is, the person is writing who and the only reply there are I was requesting for 87 positions of medicines for oncology children, patient children. He said that one will hopefully be supplied, the second maybe, the fifth maybe in the nearest future, out of 87 items. And we did not include the products of medical use. There are more than 200 of them. And one more thing for the mass media, we're using different platform like in old times, but we hope we'll organize our own press conference. Now talking about investigations. Previously, the representatives of Tabletочка Fund and other funds, patients of Ukraine, it was easier for me to act, and when we were requesting the investigation on some civil servant, the investigation was appointed faster. Now we have sent the request. The signatures, there are signatures of more than 100 deputies, members of parliament of from different factions, and that is the request to start investigation against the Minister of Health, Kvitashvili, and also against the first deputy minister, Alexandra Pavlenka. Here, this is the request to Arseny Petrovich, signed by 100 members of parliament. When tomorrow, the day after tomorrow, people will come out to demand treatment, I hope that they will react faster to them than to the request of more than 100 members of parliament. That's a paradox. Thank you. If I may, Tabletочки Fund, respect them. I am sorry